So I found out I had sickle cell actually from my mom. She told me that when I was about 2, I had my first sickle cell crisis. She said that I was, I guess, limping around the house. She didn't know why. I guess I was in pain. So I found out when I was 2. But since then, I've had sickle cell obviously my whole life. But as far as crises and things go, it's kind of been up and down for me. Person to person, sickle cell differs. And so sometimes, in some people, they're a lot in the hospital, a lot more than others. Me, I have been in the hospital probably 4 times per year up until now. And that's pretty good. For me, I have sickle cell SC, which tends to be like a milder version of sickle cell. But as I've grown and as I've gotten older, sickle cell has also gotten a little bit better for me. I don't know why. But even in the last 2 years, I haven't had a major crisis, which has been excellent for me. But yeah, so I just deal with it day to day, deal with the consequences of it and what I have to do to take care of myself in order to maintain it. For instance, right now, I have necrosis in both of my hips, which means that part of your hips, the blood flow to your hips is slowly dying, so when I'm standing around, walking around, doing too much stuff that causes pain in my hips, it's a consequence of the disease. So I say consequence lightly, only to say that there definitely is a downside to having the disease. There definitely things that you have to deal with when you're maintaining the disease, even if you don't have a crisis or you're not in active crisis. My first major crisis that I remember when I was in kindergarten, and I got chicken pox. And so pretty much any large stress on the body can cause sickle cell crisis. So chicken pox is a stressor on the body. So when I got chicken pox, I remember having chicken pox in general, but also feeling super sick. And because of that, I was in the hospital for like a week or something. I just remember not feeling my best. I remember my mom my parents kind of feeling sad. My cousin, who's really close to us, I remember her visiting me. So that's like probably my first memory of having like a major crisis. And that one, they weren't sure I was gonna make it either. So it was kind of like, I don't know, the weight of it at 5, I don't know. I mean, I that's just the first one that I remember for sure. I don't think I really understood that I had a chronic condition until maybe elementary school, middle school, when I was in and out of the hospital. So some months were better than others. I wasn't always in the hospital, but I definitely was having crises at home where I would have to take medication. Obviously going to the doctor, having to go to an extra doctor because now I have to go to a hematologist outside of a regular doctor. So I feel like the weight of sickle cell or understanding it, I would say like around elementary school, because that's when it was back-to-back crisis and back-to-back seeing the doctor, and also not being able to participate in things like playing in sports and different stuff like that. Or when I was having whatever stress of a 10-year-old, I would get a crisis or whatnot. So I think that's when I kind of like really understood that I had like a actual condition. In middle school, I wasn't able to play any sports because my mom was didn't want me to have, like I said, stress, any kind of active stress, whether, that could be physical, that could be mental stress, that can cause crisis. And so she was just super afraid that I would have a crisis, afraid that I wouldn't be hydrated, doing all the things. The sports, I'm not good at sports, but what I wanted to do in middle school, I wanted to play basketball because we used to play basketball with our friends in the street. So I wanted to try to do that. I wanted to try to do track. Like I was just interested in those things, and I just wasn't able to do that. And I kind of felt like I knew better than my mom, because I was like, I feel like I could do it. But she definitely was like, no, we can't. You got to sit down. You have to, take care of yourself. You need to stay hydrated, all of those things or whatnot. And so I don't know. It was disappointing to me because I got to see other kids go out and try for these things. And I knew that for me, it wouldn't be, not that it was easy for them, but it wouldn't be as easy to just say, oh, I'm interested, let me go play. It was a whole thing. Like if I had to, of course, run it by my mom, but if she felt like it was too extraneous, then she was like, no, you can't do it. I played flute when I was in middle school, and I loved it. I was good at it. I was second chair. I was doing good or whatnot. And so I did band all of middle school. I did band into high school as well. And I also marched and played in a couple of ensembles. And then I went to FAMU for college. So I was in the Marching 100 as well, which was a whole nother thing for me because now I'm having to manage my sickle cell by myself. I'm away from home. And that was another thing my mom was concerned about too. But even with that, I was able to march. I did have some crises. I did have some crises on the road where I had to go to the hospital. Sometimes we were out of town or whatnot. But at that point, at 18, 19, 20, I was able to manage my, myself in general. I was able to know what my limits were. I knew that. So going through high school to college, I knew that if I did enough of anything, my body would adjust. So I kind of built up endurance for certain things. So I would have to go through that process of maybe having a few crises, but if I was consistent enough with it, then my body would adjust, for me anyway. So it became a little bit easier for me to manage while I got older, as I learned myself and learned what things caused me to go into crisis. I don't want to have to tell you that I'm a pharmacist. I don't want to have to tell you that I'm a nurse. Like my mom doesn't want to have to tell you that I'm a nurse, because technically, all of that doesn't matter, right? You don't need to know anything about me in order to treat me properly. You don't need to know that I do this and that I work here and that I'm this person and that I'm this, that, and the third. You don't need any of that. You need to just do your job. So anyway, I was in the ER. I came in for a crisis. I was in pain. The ER doctor who came in, he was like, yeah, so tell me what's going on today. I told him, and I obviously, like I said before, don't look like I'm in pain, right? Because I deal with pain all the time. So you can kind of tell sometimes when people don't believe you, because then they start probing you with questions that are like, why are you asking me this? So it was kind of like, where's your pain? I told him it was in my shoulder. He asked me to raise my arm. Why would you ask somebody who's in pain to raise their arm to show you that they're in pain? So I raised my arm, showed him that I couldn't, move it that much. And he was like, okay. So he left and came back. Started fluids, which is usual. Got some blood work, which is usual. He came back and said, you don't have sickle cell, right? And I said, I actually laughed just like that because I'm looking at him like, what are you talking about? And he's like, you don't have sickle cell. I looked at my mom because I'm like, because I have a composure about me because I try not to go off on people, right? As you can see, like I said, I was annoyed, okay? So I try not to go off on people. So, and then because I'm also trying not to be the belligerent patient who's going on, whatever, because again, those things aid in your bias toward me. So I was looking at my mom. She was like, well, what are you talking about? What do you mean she doesn't have sickle cell? Check the records, right? So he goes back, he says, no, I think you have like a rheumatoid arthritis or you have some kind of, are you sure? I said, yes, I see a hematologist. I've come to this hospital multiple times. I told him the hematologist's name at the time. My mom was like, if she doesn't have sickle cell, then what has she been dealing with for the last 20 years of her life? And he's just like, I'm not sure what she has, but it's not sickle cell. So I asked him, I said, what's telling you that I don't have sickle cell? So he did a rapid test for sickle cell, right? So a lot of times what tells the doctor that you have sickle cell is a test called electrophoresis. It is soundproof in telling you your blood, right? He didn't do that. He did a rapid. But if you do a rapid within a time frame of receiving a blood transfusion, that rapid could give you a false negative, which is what happened to me. So I recently had my baby. I recently had a blood transfusion because of that baby, and I went to the hospital within 3 months of having that blood transfusion, which was a time frame to say, okay, the blood that's inside of your body may not fully be expressing sickle cell the way that it would for a rapid, but an electrophoresis would tell you specifically, yes, she has sickle cell. The other downfall with that too is that they had just updated their system, so the records for me being in the hospital that would say, oh, she's been here a couple of times, they didn't have access to that. So in the last year, I hadn't been in the hospital because I was pregnant. And so he didn't see that I had any history here at the hospital. So that was one. But two, he already walked in there and assumed that I didn't have or wasn't in pain because he went and did something that confirmed what he already thought. So he's telling me I don't have sickle cell. He doesn't know what kind of pain I have, but he's saying, you don't have sickle cell, you don't have this, you don't have that. So he gave me Percocet, which is a tablet, which in a sickle cell crisis, most time patients are taking pain pills at home that aren't working. So when you come to the hospital, you should be getting something IV. Didn't do that. Gave me something by mouth and said, yeah, follow up with your whoever, and basically sent me home. It shouldn't be disregarded that I came to the hospital for treatment. I have sickle cell, known history, but then this doctor is telling me I have rheumatoid arthritis or some kind of other pain issue. And so those are things that you have to deal with. So while I'm still in pain, this doctor gets to tell me that, one, that I'm not in pain, that I don't have sickle cell, and that I need to follow up with another doctor to tell me what it is exactly that I'm dealing with. If I was a child, that would never really happen, to be honest. But again, I'm here as an adult in the ER trying to convince you that I have what I say that I have, that I am in legitimate pain, and that I do need some kind of treatment. So I had to leave and then come right back just to do this all over again with the next doctor, hoping that I wouldn't have the same experience, which fortunately I did not. The advancements that I would wish to see in the treatment for sickle cell patients would be education of clinicians, all clinicians, doctors, nurses, whoever. It would be if there could be more sickle cell day clinics, or even 24-hour clinics that will allow us to bypass the ER and be able to go somewhere specific for sickle cell treatment. And then thirdly, research, or funding, I should say, to research for sickle cell treatment in general. I think what FSCDR is doing is great. Like, I couldn't applaud them enough for their efforts in trying to make sure sickle cell patients are advocated for, that sickle cell patients have a place to be treated, that sickle cell patients have doctors who know what they're doing. Like, all of that is so much of a great thing and so much of a relief for somebody who can walk through the doors and be like, okay, I don't have to convince people to treat me the way that I need to be treated. I'm actually surrounded by people who know what they're doing, who care about what they're doing. And I feel like that is such a great thing for them to do for sickle cell patient population in general. I went to their older facility to be seen by Dr. Blyden. I have talked to people on the phone, and it's like their knowledge is such, like, they have so much knowledge on the disease itself. And even some of them used to work for Memorial and came over to start and do more research and do more for sickle cell patients with this organization, just because other people, they're just not doing what they need to do. They're not really putting their foot to the ground and trying to get research done, trying to get funding, trying to make sure that there's actual, a clinic for the patients to come. So for them to have doctors who know what they're doing, have nurses that know what they're doing, for them to have their clinic, for them to now move into a bigger, facility, for them to just keep growing, I feel like it's honestly amazing. Like, I commend them because I appreciate them, because they're needed in a community of people who don't get to experience having the right kinds of treatment or the right kinds of people interacting with them to really manage their disease. So I commend them.